So it is community spread, and that's why it's so important that we take the actions that we did in and around Whistler to try and reduce those opportunities for spread. And we are supporting people to self-isolate if they're in group accommodations, for example, to isolate safely. We have places to support people to do that. So the same measures that we take that for COVID all along work for the variants. We just have to do them more carefully, and that's more important than ever this weekend.
Maybe the active case numbers as
well. Oh, yeah, the active case numbers are actually down a little bit. This will all be in the statement, but they're down to 192, and we have 35 people who are currently in hospital with one of the variants. I've mentioned this before, but we do follow the demographics, and what we're seeing is it is mostly a younger age group between 19 and 50 overall. And for the P1 that we're seeing, not surprisingly, given where we're seeing it, mostly 19 to 39-year age group.
Richard, do you have a follow-up?
I do. I've heard a lot from a group of people across the province from age 65 to 71 who quickly saw people slightly older for them get chances to reserve vaccinations. They have now seen some younger than them in Metro Vancouver not be able to receive AstraZeneca. There's a lot of frustration from this group that wants access to the vaccine. I know there was an update today for one of those years, but can you give these people some hope of when they will be able to register for their vaccine and explain to them why seemingly it is taking much longer to get to them as it was some ages around them?
Yeah, you know, and there's two different things that are going on there. One, as we've moved down the age groups, it has been very closely tied to amount of vaccine that we've received. And Minister Dix mentioned we were expecting a large shipment of Moderna last week, which was delayed, and still a large part of it hasn't arrived. And in addition, we have the clinically extremely vulnerable group that has now started to be in, and that's another 150,000 people. And as we move down every single year, the number of people or the cohort gets larger. So it was, and some of the health authorities, particularly in the Lower Mainland, when they had vaccine last weekend, had gone down to 73. But then as more vaccine didn't come in at exactly the right time, it was kind of stuck at that age for a couple of days. So we are titrating it to vaccine that we receive, and we've gone down today. We expect in the next few days, as more vaccine comes in next week, assuming it all arrives when expected, that we'll be able to continue to move down to the, hopefully very soon, to 70, 65 and up. So the rationale or why we had a small amount of the AstraZeneca, it was after we had seen the safety signal. We weren't sure how many people would be receptive to receiving it, and I'm just very, very pleased that people have recognized the value of this vaccine, and we had a small amount of it that was expiring tomorrow, and we targeted it in the area where we have the highest rates, and we wanted to target the population that was not likely to be in the age group within the next few weeks. So that's the rationale that we used to make the decision about where we put the 18,000 doses of the AstraZeneca. So it wasn't in any way to slight those in the 65 to 72 age group. It was because we knew there was more vaccine coming into that core of our program that would be available within the coming days and weeks. So it's trying to find that balance of getting both at the same time as much as we could. And really what the challenge has been that I'm working on, that we're working on, is we were committed to using the more flexible fridge-stable vaccines for our worker program, and we'll need to recalibrate how we're going to do that. So I'm asking for patience from all of our first responders and the other worker groups that we had identified. We have been using vaccine, as you know, to try and address workplace outbreaks, and we don't have that supply right now because of the stop on using of AstraZeneca with the younger age group for now. So we are hopeful, and we'll be following. I know much of my weekend will be looking at the data that's coming out of Europe and following up with our colleagues in Health Canada, and hopefully we can get that back on track as soon as possible. Still 5% of people are hospitalized, 19% of all ages need ICU care. People with variants, that's up to about a third. So we are seeing, but the numbers are still relatively small. We're in I think that we're up to about 60 people now. So it does make a difference. We're looking at that in some detail, but where we're seeing transmission, again, is the same settings that we're seeing it, and why we took some of the measures that we did this week. What we see is transmission in social networks, so where people are having social gatherings together, and many of the same people are working in the restaurant or hospitality industry, living in group accommodations, living in crowded homes with others. And we're seeing spread in all of those environments. And particularly, we know that these variants and the virus that we're seeing is spreading more quickly indoors. So our margin of error for having people together, not wearing masks, indoors, with poor ventilation, talking, laughing. You've seen some of that on some of the video from certain places this week. Those are situations that are very risky right now. So that's why we have been focusing on where we can do things safely, and that is outside. Keeping our distance outside, having those social interactions in ways that are safe right now, particularly if you're going to be around your elders and seniors, and make sure that we can do that safely so that we can all get through this and be protected.